Hello everyone, a very good evening. Today let's discuss on another important national program, that is our National TB Elimination program. So this is also one of your 5-mark question in your university exam. So in National TB Elimination program you have a few main points. It will be like you have to mug up the points only, okay. So we'll try to make it as short as possible, okay, and we'll try to understand here. So in National TB Elimination program, the central government has renamed our RNTCP program into our National Tuberculosis Elimination program in the year of 2020. So whenever there is a program, you will be having a goal, your vision, and there will be a strategic plan for each of the program. You have to write all such subheadings for your answers. So what is the goal of your National TB Elimination program? It is a goal of ending TB by 2020. So it is a goal of ending TB by 2025. And what is the vision of this program? That is your National TB Elimination program. TB Free India. What does TB Free India means? So TB Free India means with zero death, with zero disease, and with zero poverty due to tuberculosis. Okay, that is the meaning of TB Free India, and that is the vision of your National TB Elimination program. And we have 4 strategic areas in this program. So the first one will be your detection, that is how do you detect that the person is having a TB. Then how do you treat the patient? What is the prevention method that the government has taken for this? And fourth one is your build is nothing but the political support what they have taken here for building this program as strong as possible. And we have 5 main priority areas in our national strategic plan. So these 5 main priority areas are: one is involving the private sector. First one is involving the private sector. Okay. Second one is plugging the leak in the cascade, TB case cascade. What is the meaning of plugging leak from TB care? This is TB care cascade. That means people with TB going missing from the care. So you have to see through that the patient is getting a proper diagnosis, proper treatment, and completing the course of the treatment. So that is people with TB going missing from the care. So that should be stopped. Okay. And third priority is active case finding. So what's the meaning of active case finding and passive case finding? Passive case finding is people with the symptoms come to you and you then diagnose the patient to have TB. While active case finding is you go to that particular area where the patient is, where the key population is there. That is mainly when a patient comes to you with a TB, and you have to screen for all the contacts of that patient so that you can find whether the patient is having a latent TB or not. That is active case finding from key population. Yes. Fourth point is preventing the development of active TB in people with latent TB. Okay. So you have to start treatment when you find that the contact of that person is having TB. So when the contact is having a TB, that is you have to label them as latent TB, and that latent TB you have to start on treatment. But for what? Because for what you are starting treatment for a latent TB patient? For preventing them into a conversion of active TB. So preventing development of active TB in people with latent TB. Next, programmatic management of patients with drug-resistant tuberculosis. So there should be a programmatic management of drug-resistant tuberculosis. Drug-resistant tuberculosis. These are the 5 main priority areas in which our national strategic plan has taken action on. Okay. Yes. Now we'll see in detail about how to detect, treat, prevent, and build. So first is detection. So it is to detect all those people with TB, tuberculosis, both drug sensitive and drug resistant TB. First, scaling up free high sensitivity TB diagnostic tests such as CBNAT. So they have introduced CBNAT, which is a high sensitivity testing, high sensitivity TB test for free of cost in all your government hospital setup. Next, there should be a universal testing. So there should be a universal testing for drug resistant tuberculosis. Third, there should be a systematic screening. So there should be a systematic screening of high risk population. So these are the 3 main points you have to write in the first strategic area, that is to detect. So how we will remember these 3 points? One is CBNAT. You have to write about CBNAT in this. That is made of free of cost, which is a high sensitivity tuberculosis testing. Second is you have to write regarding your drug resistant tuberculosis. There should be a common testing pattern for all the drug resistant tuberculosis patient. Third, you have to write regarding screening of your high risk population. So that is your key population. These are the 3 main points you have to write in the detect topic. Next, how do you diagnose? What are the methods that have been present in your government setup for diagnosis of a patient with tuberculosis? One is sputum smear microscopy. These are easy points. This one you have to compulsory you have to write in your exam. And next will be your chest X-ray. Next is your latest one is your CBNAT. Right. Another one question is important question, which will be your latest treatment guidelines or latest methods of diagnosis of TB. That is your CBNAT, your TrueNAT, your gene expert. Everything you have to remember, and everything you have to write it in detail. Also, if they ask such questions that can be asked in your recent advanced paper, I'll make that topic also in our next video. Okay. Next, how do you treat this patient? First one, cascade of care. What is the meaning of cascade of care? That is, this is care. Cascade of care meaning every step in provision of treatment. Every step in provision of treatment should be present. Providing free TB drugs. Say third point, providing treatment approach guided by drug sensitivity. So you have to provide this treatment based on your drug sensitivity testing. So treatment approaches by your drug sensitivity testing. Fourth point is monitoring the treatment and social support in order to sustain the TB treatment, because there is a many chance of non-compliance of your TB drugs. So you have to monitor the treatment, whether the patient is taking the treatment regularly. So monitoring the treatment, and you have to give a social support to that patient. And social support in order to sustain the TB treatment correctly. Fifth one, not only drugs, you have to provide nutritional support also. Nutritional support to the patient. How they are providing nutritional support? It is announced that the patients with the TB will get rupees 500 per month for food. So this is of they give a nutrition. This is of government gives a nutritional support to the patient by giving them money as 500 rupees per month. So in treatment, free TB drugs. Next you have to monitor the patients whether they are continuing the treatment or not. Next is nutritional support, and another main point will be your providing amount like 500 rupees per month. These are the main points in treatment. Next, how do you prevent? How do you prevent this? First point will be your scaling up airborne infection control measure at your healthcare facilities. So scaling up your airborne infection control measure at your healthcare facility. Second one is by providing treatment for latent TB patient. So by providing treatment for your latent TB patient, you will stop the emergence of active TB. So providing treatment for latent TB infection. Okay. Next. This is in prevention. This is third point. Third subheading for your strategic plan. And fourth subheading of your strategic plan is build. In build, it is your restructuring of RNTCP program. Second one is translating high level political commitment into action. So translating your high level political commitment into an action plan. Okay. Third point will be building supportive structures for research and innovations, like bringing new methods for diagnosis of tuberculosis, then bringing up new drugs by doing researches. So you have to, the government has to provide supportive systems for research and innovations. So these are the main points you have to write if they ask a question regarding National Tuberculosis Elimination Program, right? So I have made it very as simple as possible. You have to write the goal. That is, goal is by ending tuberculosis by 2025, and vision is TB free India. 4 strategic areas is detect, treat, prevent and build. In detect, it is mainly your CBNAT and universal testing for drug resistant TB and screening method for high risk population. Then you have to write regarding sputum smear microscopy, chest x-ray and CBNAT. Then how do you treat? By giving free drugs, monitoring the treatment and by providing nutritional support. And how do you prevent this? By scaling up airborne infection control measures at healthcare facility and starting the treatment for a patient with a latent tuberculosis. How do you build this? By restructuring the RNTCP program, and there should be a supportive system for research and innovations in diagnosis of your tuberculosis. Okay, thank you. Next topic, I will make another video regarding our national tuberculosis program. Another video regarding our national programs Indian Newborn Action Plan. You have that Swachh Bharat. You have Janani Sishu Suraksha Karyakram. You have many national program talking. I will try to finish it by this week. Okay. Thank you. Please like, share, and follow our YouTube channel. Let's all learn our pediatric together. Thank you.